Laquita, you're on mute if you're speaking to us.
Danielle, now you can hear me? Can they,
Yeah, you should be.
because I should have mine on mute so it doesn't,
Hello? Are we heard?
yeah, Danielle's shaking her head, yes, but she's muted.
Okay.
Monica's on, the lady with violence and, I don't. I'm not gonna, I don't wanna use my phone, I wanna keep it on mute. Can everyone hear me? I think I heard, or saw Danielle shake her head, yes. I'm just gonna give it a few more minutes, everyone. Thank you for waiting. It's 6:31. So we're on time, but our meetings have been generally starting between 6:30 and 6:35. Occasionally, there's a 6:40, but we won't wait that long this time. But I would like to give it to, 3 more minutes. Thank you. Let's see the chat. I don't think that they can hear.
Yes.
Okay. Hey, Sandra. Okay, we're gonna get started. Thank you so much, everyone, for coming to our first Health and Environment Committee meeting for the fiscal year. It is now 6:34 p.m. And so I, with that, have called the meeting to order. And before I do the next thing, can I have a motion to adopt the agenda, or if there are any changes anyone wants to add to the agenda? So I need a motion for one of
Motion to
you.
adopt the agenda.
We've heard a motion, oh, Justin did, our new member's first action on the committee. May I have a second? Second. Okay, Mike, go ahead, Iglesias has seconded, all those in favor?
Aye.
Okay, and actually, we don't have minutes, we're gonna be making some adjustment to that. With the recording, I do have a minutes taker. Edward Torres has agreed to provide all the minutes this year. He may not be able to sit in meetings, but what we'll do is get the tape to him, and he'll definitely knock out the minutes. But it still would be great to have, once everyone's here, someone actually in person to take the minutes also. So I'm hoping that will happen. If anyone wants to volunteer now, I will take a volunteer. Okay, well, everyone can think about it. And we'll see what we can go from that point. I'd like to do an introduction of our new members. And Felipe, I know that you're online. I'm sorry you can't you're not here in person. But let's start with you so that we'll begin to see our new members and know something about them and what makes the Health and Environment Committee an important committee for your attention and participation. So Felipe, you go first. Unmute yourself.
Yep. Hi, everybody. Really happy to be here and on this committee. Health is one of my interests. I'm a medical doctor. You know, whether it's at the individual level or at the population level, I know that health is something that interacts like very strongly with the environment that we live in. And yeah, happy to be here.
What's your area of medicine, Felipe?
I'm a psychiatrist.
And we, over the last 2 years, have focused very heavily on mental health. And if there's a particular topic that you think should be addressed or something you're facing or seeing that we should know about and be able to impart to the broader community, we welcome that. So I know I'll be calling on you to assist us, particularly in that area. But, you know, I know you want to do things that are different sometimes when you're looking at the community broadly. So there'll be other opportunities as well as that of mental health. Thank you.
Yeah, absolutely. Yeah, I think one thing that really interests me is actually traffic violence. We have a lot of traffic violence deaths in New York City. That is people, you know, getting run over by cars. I was hoping to sort of like focus on that.
Okay, what about motorcycles, motorbikes? And
Yeah, the numbers really don't show that. The numbers are heavily leaning towards four-wheeled vehicles and larger vehicles mowing down pedestrians. Electric bikes and motorcycles do not cause nowhere near the amount of deaths that are caused by cars.
we would welcome that. And if you feel super excited about it, if you want to speak on it.
Yeah, absolutely. Yeah.
Okay, so we'll look to have you report something to us and we'll see how we can get that information out more broadly. Okay?
Okay, thank you.
Michael, you next. We'd love to hear what attracts you to health and environment and how you feel, you know, if there's a particular area of interest you have related to healthcare and the environment.
Yeah, I mean,
Michael Iglesias, everyone.
yes, my name is Michael Iglesias, currently a Columbia Law student, about to graduate pretty soon. What draws me to the Health Environment Committee is my previous volunteer experience. You know, I like to volunteer with a number of organizations. One that I'm most passionate about is helping out with the Special Olympics.
Is what?
Helping out with the Special Olympics, and I enjoy helping out with communities that are not as well represented, and you know, people that may not have that opportunity, like, you know, people who have physical or mental disabilities need to be heard and seen. And so I hope to help out wherever I can in that regard, especially with communities that may not have the voice.
Okay. Very good. And if, again, with, I guess we said Special Olympics, like, I guess at the Olympics itself, they called it Para Olympics. Doesn't hurt for us to know, maybe feature some of the challenges, which I'm sure there are many.
Yeah.
That they have to go through. That would be interesting to hear. Justin Dent, welcome. And you are our new member on the board, and what attracts you to health and environment?
Well, as you know, Nikita, I come from a family that's been in MCB9 for a long time and had a very vested interest in the health of this community from health. You know, I grew up essentially at Heritage Health and Housing. And so have had a lot of interest in the psychological and physical health of this community from the time I was a child. So, you know, and I come at this committee from a very holistic lens of health and wellness as a yoga and meditation teacher, as one of the many things that I do. And so I'm very interested in general about kind of more equal access to wellness and health outcomes and resources for communities of color and for low-income communities across the district. And then have a very personal and vested interest in just environmental justice and more equal outcomes across that, and how different environmental policies and changes affect our community as well.
And we have a relationship with We Act, and sometimes wouldn't hurt if there could be representation at some of their they have groups that, like, I'm a member of the climate justice group, but not always able to attend. They have other groups as well, and many of their members have spoken at our committee and shed a lot of insight on what's going on with the environment, whether it's the beauty industry and mercury content of many of their products. There's Rainproof NYC that the mayor started, and it's been meeting. There were a number of people selected to be part of that. For example, one being Caleb Smith with We Act. That's a super important group. And I haven't had him down, but I don't think he will be able to speak this evening, but they have presented, as well as Cameron Clark. And Cameron's area is housing and health. So anyway, they'll be coming back, but if we need some representation in a number of areas. And so that's where hopefully we can use your interest there. And Michael, in terms of law, Odette Wilkins is not, I don't see Odette with us this evening, but she's a lawyer. She's doing a lot in terms of technology. Legally, there's a lot of bills that have been before Congress. They pop up and there's no representation in terms of parliament. There's just so much activity. So if we could kind of designate some representation, that would help us have a voice for the Harlem community, as well as being able to come back and report and say, look, we should do a resolution on this, we should have some interaction there or other. So that's what we really put. I think that would be a good fit, technology also. So thank you. Heather has been with us, you know, and she's been a wonderful member, always shedding light on aspects of health or any topic that we may not have thought of. Heather, can I give any?
I'm also co-chair of the Landmarks Preservation and Parks Committee. I've been on the board since 2019, so about almost 5 years. So my interest in health is have a wide variety of interests, but food security, especially in healthy eating, is important to me. Clean air, water, climate change, and energy conservation. Solar, wind, renewable energy is important to me, and living in a healthy environment, healthy home, have always been of importance.
And Heather, I want to publicly thank you again for attending, really unexpectedly, some of Odette Wilkins's meetings related to technology, whether it's the oh shucks, on the phone.
The 5G.
The 5G, we did a resolution on that last year as well, but there's so many topics. And is that Divine back there? Oh, okay.
I'm a divine spirit.
Yeah. Great. Okay, your name?
My name is Barbara LeGrant, and I usually go to the arts and culture meeting, but I'm learning, and I primarily focus on dance, but I'm learning that there's a lack of movement in health related when it comes to just how to use your physical body to stay healthy. But I'm also environmentally conscious too, because I deal with renewable energy, but not necessarily in this community. I kind of went outside states and coming back around. So I just feel that there's a connected thread with, you know, how you can maintain yourself. And really teach children that you don't become healthy now so that it doesn't play later. So that's sort of where I am. So I wanted to see what was happening with health and environment. So that's why.
Okay, so you're on the board, but you're
I-
not.
I'm an elected member. I attend those meetings.
Okay, so we welcome you to come at any time and participate with us. Thank you. Is that, okay, so give me your name.
Nicholas Camilo.
I was going to say that and I said, well, maybe I shouldn't get, but your first name is pronounced
Nicholas.
Nikari. So welcome, Nikari, and tell us your interest in health and environment.
Well, I was raised in this community, over on 143rd Street. And since I grew up in the community, I've always been involved, helping people and I'm really interested when it comes to, mental health. And, where we at as a community, and say, giving a hand to others. That's why I decided I wanted to join the community board. I myself have a master of administrative clinical counseling.
Administrative.
Ministry and clinical counseling.
Okay, welcome. And welcome to to everyone here. We need everyone's thinking and participation, so we look forward to it. There was someone, you know, I just said, okay, in terms of note taking, so I don't know who that was. Oh, that's Edwin. Now he's got somebody. Thank you, Edwin. I had announced you, but you have these different sign-ins, so I didn't know. Thank you. So I clicked yes. Okay, I don't know if, let's see, is Joyce here? Joyce Freeling? At some point she may come on. Is Tiffany? Tiffany Khan? Oh, we're early. I told her wrong.
Sorry,
Are you there,
I was on
Tiffany?
I was on mute, sorry.
Okay, well, I'm glad that you and I talked earlier, and so I have you earlier. And so let me just mention, this is a time in our meetings where we do announcements and presentations. And from these announcements and presentations, we not only learn what's going on in the community, maybe some of the activities that we're handling ourselves as a committee. But we listen to presentations that many are super important, where we end up with a resolution. And resolutions are very important in terms of the information and insight that we could give to our city council members, our Senate and Assembly representatives of this community, so that they can know our thinking, they can get some direction from us and ideas and emphasis on where we think some legislation and policy should be driven. So this is a really important
Good evening, everybody.
area.
So,
Good evening.
Ernesto Vega. Yeah. I am assigned to the committee. What's your name? Ernesto Vega. You there? You have a list of the committee members?
Yes, excuse me, everyone, this is the second
Have a
here.
seat. Yeah.
Um,
and take a agenda.
No, I don't have it. You remember the board?
Yes, yes. No, see,
And CB9 and, no, we don't have your name, but
have a seat.
just have a seat and we'll keep going, because we're in the middle of a meeting right now.
Before you, okay, thank you. Before you continue, I want to introduce myself, if you don't mind.
Yes.
Okay.
That's good. Okay, give me a second here. We have one, interruption there, but it ends up being very timely. Because we have with us our chair of the board, Victor Edwards. And welcome, Victor. It's always great to see you at one of our meetings, and you do come to a number of them. And we want Victor to make a few remarks to us.
Thank you. Good evening, everybody. I came to welcome our new members to the board.
Yeah, so maybe a little bit on hand.
You belong.
They sent me an email.
Have a seat, you belong. I say you belong, you belong.
Okay, thank you.
So, yeah. Okay, so, like I said, welcome to our new members. Glad to have you here.
Thank you.
My concerns with health, far ranging. My prior life, I was a guidance counselor here in Harlem, not too far away. And I saw how mental health and underserved communities were affected. So this committee has always been close to my heart. Also, Laquita and the committee has recently investigated sickle cell anemia. And one of my close friends, who I'm the godfather for her, one of her daughters is a sickle cell survivor. And I introduced Laquita to her, Montez Davison, and she's done some work with Laquita. So it's important. Health is very important. It's often not thought about. And like I said, underserved communities in particular don't always get the treatment and necessary attention that we should get. So thank you for the topic.
Thank you, Victor. And Victor mentioned one of the projects we had related to sickle cell disease. And I am hoping that Audrey Adams will be able to join us at some point this evening, but we'll see. To talk more about that project. If not, I will mention what I do know. September, the month that we're in right now, is sickle cell disease month. And there is a second project that we have in the works, but we had to reschedule it, and so hopefully we'll find out very soon at what time that will take place. Before talking more about sickle cell, I'm gonna sort of wait and see if Audrey will jump in, because she will have a lot more information. I talked to her yesterday. She's got a lot going on too, as in the communications field. But I'll wait a few minutes and invite at this time Tiffany Khan. Tiffany coming before us right now is critical and very important, because during the end of the summer, there was spraying for related to our climate and trying to tackle diseases that come from insects, most notably mosquitoes. We did a resolution end of June, which passed. It was drafted by Tiffany, but I wanted her to provide an update. And so Tiffany, if now you can do that, and if there's anyone who will be joining you, let me know, because I can make you a co-host, or if there's information, materials you need to share or other. You want to be made a co-host?
Sure. Fine, that's fine. It doesn't really, I can just jump right into some of the updates. I actually just discovered a few. Can you hear me?
I see you now.
Yes, we can hear you.
Okay, great. So I wrote this agenda in June and was deeply dismayed to see that the city, forget my resolution, there have been groups that have been doing this for the past quarter of a century. I'm very pleased to have Mitchell Cohen as well as Catherine Swan from the No Spray Coalition that are both on the call as well. They were also involved in the lawsuit. There was I mentioned in the resolution, the 2007 lawsuit with a federal judge actually ruled that the city should not be doing this. The city has been able to circumvent this by declaring an emergency every year, as they have been for the past 25 years. This ban on the pesticide spraying is purposely towards the West Nile virus prevention. There is no data that shows that this spraying has done anything to mitigate the disease, to improve public health, but there's plenty of data to show that it is incredibly toxic for all animals, humans of course included, as well as the ecosystem. There are better ways, solutions that can mitigate not only West Nile virus, but other diseases that mosquitoes carry. And one simple solution, which I just was speaking with Joel Kupferman, he's one of the attorneys who was involved in the lawsuit just a few minutes ago. He pointed out that NYCHA, for example, has standing water that the city is not doing anything to prevent. We all know this is one of the ways that mosquitoes, the population, this is how they mate, how they their larva grows. So earlier, I was speaking with just a few minutes before the call as well about a disease I not heard of. It's the Eastern equine encephalitis, but this is irrelevant because the spraying, the annual spraying, again, is specific to West Nile virus. So I don't know. I can speak for hours about this. I know we don't have time. So if you had, if you know what would be better, a better use of time would be to defer to Catherine or Mitch. Mitchell, if you guys would like to say something.
And Mitchell, I made you a co-host because I didn't know if you had material to share. Welcome. Thank you for being here. And thank you, Tiffany, for those invitations to Mitchell and to, is it Catherine? Yes, Catherine.
Yes, Catherine Swan.
I can, if you have material to share.
Hey, thank you. And thanks, Tiffany. You've pretty much said it all. If the city is going to spray for something other than West Nile, then it has to file the proper forms, and I'm sure they will approve their own forms. That's what they do every year to give themselves a waiver, which is how they get the spraying done. But that hasn't been done. And the toxic nature of the pesticides being sprayed, cancer-causing substances are in it. Piperonal butoxide is one of the things that are in it, along with the pyrethroids. There are other things mixed in with it, and these are all very dangerous, neurologically dangerous, especially to children. And we won our lawsuit against the city, filed in 2000, and it was resolved in 2000. It was decided in 2006, so 6 years. And then in 2007, the city entered into a settlement agreement to settle the remaining issues here. And it's as if the city doesn't know. There's no institutional memory at all. So this is actually still in existence. And the city is just violating its own rules and agreements and settlements and a federal judge's ruling. So let's see, we had most of the community boards online agreeing not to spray, to oppose the massive spraying and poisoning of the entire city. And I can talk more later if you want me to. This much appreciated here. It's really important not to spray all wildlife and all people because there's an ailment possibly out there carried by mosquitoes, maybe, that causing a minor number of people, very minor. No, nothing is minor, right? People sick, they're sick. But compared to poisoning the entire population and cancer causing chemicals and neurological and endocrine disruptor chemicals, which they all are, then that's just not a way of dealing with it. And I think Tiffany knows some of the other ways that this could be dealt with through natural insects. Dragonflies eat mosquitoes. Bats eat mosquitoes, certain fish eat mosquitoes, frogs eat mosquitoes. You could use natural ways of dealing with mosquitoes as they come about, especially dragonflies. I love dragonflies. And it's amazing how many, a dragonfly could eat 1,500 mosquitoes, and a bat as well can eat a huge number of mosquitoes. So if you go out around in Brooklyn, I go out to the cemetery, to Greenwood Cemetery sometimes, where there's a pond, and it used to be covered with mosquitoes there. And then one year there were all these dragonflies there, and I just sat there and didn't get a single bite. In 2 days I was sitting out there and just reading and hanging out. So it's pretty amazing, and the city could be doing that, and they're not. And why aren't they? Pharmaceutical profits? I have no idea. Need to ask the city that. Yeah, I'm sorry. Okay.
No, that's okay. Before we open up for other questions, Catherine, would you like to add to what's been stated? I'm not sure if you're muted or not, or if she's still there. So what was your oh, Tiffany?
So Catherine perhaps can jump in, and please do interrupt me. I just wanted to add a few things. There's the cumulative impact, which Joel also points out, of people being hit by some of these toxins from different sources on top of the spraying, right? We also have, in apartment buildings, we have this pest control, the landlords, for example, or other groups, even co-ops, will bring in exterminators to spray around people's apartments. And then there's spraying happening in other places. People have a lot of exposure to many toxins all at once. And although this might be a bit anecdotal, I can't help noticing that it's not just anecdotal. This has been shown, and unfortunately, it took someone like Kate Middleton at the start of the year coming out and saying, I have cancer, for most of the major media outlets to say, oh, look, there's a surge in cancer, unusually so among millennials. Cancers that you would find in people in their 60s or in their 50s, even. I don't have the resources to connect all of these dots, but we need to start asking ourselves these questions. Why is there this unprecedented surge of cancer among young people, including people who have resources, who are not working in factories, or who typically should not be exposed to these things? And also autoimmune diseases. There's a surge in that too. So we need to start asking these questions and asking that the city, which has access to this data, show that the ingredients in these sprays are safe, which we know they have been shown to not be.
I know that with colon,
sorry?
There's definitely a surge in colon cancer among young people, particularly young Black men.
Yes, colon cancer, pancreatic cancer, breast cancer. There's a table that I can send you of many different, at least a different cancer, where you find higher rates of these cancers. And again, these are in young people. I'm not saying that the pesticide spraying is the direct cause of this, but it is, I wouldn't be, contributes to it. And it's this cumulative impact of other toxins you're continuously exposed to. And the city just doesn't have the best history of hiring private contractors. And speaking of private contractors, Chem Nova was fined $1 million to, they are not supposed to sell these pesticides to the city, which actually does the spraying. It's Chem Nova, Clark Environmental. I believe did they have an OSHA violation? Anyway, we don't have the best oversight mechanism. We don't have also facilities where people can go if they've been harmed by the sprays. So we have to urge that they stop doing this. I was, again, very frustrated that they did it in August when the community board had not met. So no one had time to even discuss any of this. It kind of felt like they did it, fly by night. Then there's no warning, that thing. There's not sufficient warning for people.
So Tiffany and Mitchell, I think this does warrant additional, tracing the dots or tracking the dots from one thing to the other, and a timeline that can help guide us, because we know something has to happen, and whoever the accountable agency is, we're gonna need to be able to get to them soon if we're gonna have some impact even for next summer. So I'm not sure how far in advance, but I think we need to have some suggestions on what we're gonna recommend. We need the data. And if you and Mitch and Catherine can give us some guidance on that, where's, in terms of where we should go, what the next steps should be.
Happy to.
I'm not sure if Mitchell is still on, but
Yeah, I'm here.
I think the dragonfly, I know Tiffany had mentioned that earlier too, using nature but I don't know, what are the contraindicators in that sense? I mean, what would be the opposition to using nature itself to do that?
Well, first, the city needs to comply with its own promises. Again, this standing water is known to be one of the areas where mosquitoes are spread, and they're not doing anything to mitigate the standing water around city property. This is not even privately owned property.
Okay. Catherine has said it, she says we cannot hear her. She would like to say something, but I'm not sure. It doesn't show that you're muted. I don't know what I would need to do on this end.
Are there any specific locations, Tiffany, where you're noticing the standing water? And if so, can you put it in the chat?
Heather, who has Parks Committee, is there any particular place or kind of place that you see standing water? Are you finding it mostly parks, street, sewers where the water builds up, or any particular location?
NYCHA would,
Particularly
so some of the NYCHA, I don't know, right, NYCHA property, for example. I will try to get a list of others.
Felipe said 146th Street and Convent has standing, 146th and Convent.
Is it still the street that
Harvey,
we?
So that's one location.
Yeah, we've been complaining about that with DOT. I missed the.
I'm not sure if you heard it, but Tiffany, not Tiffany, Heather has said that there's been a lot of complaints with giving the DOT in writing though.
In writing, yes, we put in several complaints.
We have.
These are and pictures, we took pictures, and also at 147th Street in St. Nicholas.
Yeah.
So there's
147th in St. Nicholas and 146th in Convent. Thank you, Felipe, for that. Thank Heather and Monique. Yeah.
I also just wanted to point out one last thing. All of the affair virus.
You're breaking up,
80
Tiffany.
Can you hear me now?
We can hear you, but it's just that there are breaks. I'm not sure what's causing the breaks. Go ahead.
Maybe it's my. I want to address the tail wagging the dog. Did you hear that?
Yeah.
And it's the issue of 80. So it's about 80%. That's 80 of the population comes in contact with West Nile virus are asymptomatic. Have it. I was from the
Okay, now
National
that's-
Institute of Health earlier today, published in 1990.
Tiffany, you're breaking up really badly. We can't hear you. Might have to adjust.
It was off camera, it might be better.
Well,
Can you hear us?
Okay.
Or go off camera.
if
Yeah.
you go off camera,
Okay.
that might be better, Justin is suggesting.
So you can conserve bandwidth.
Can you go off camera? Now it's frozen.
She may need to go out and log back in.
Yeah, I think that's what she.
Okay.
Yeah,
Yeah.
log out and log back in.
How's
And
this?
just come back
Yeah.
without.
There she is,
Okay,
okay.
great. I was saying that I have to address this issue of the tail wagging the dog, where we think, there's a lot of media frenzy around a crisis that's not really a crisis. If you think about the fact that 80% of the population, that's 80% of the population who gets West Nile virus does not even know they have it. It's fewer than 1% who do get it that have had serious cases of it. So why are we spraying the entire city for this? I'm not saying that anyone who, we should ignore people who may die of something, but why do we have policies of the tail wagging the dog? Again, we should be looking at larger numbers. When in 1999, so there were some publications about surge in West Nile virus. 1999 is supposedly when it was at its worst. It was 7 people in the entire metropolitan area. 7 people. It's of 20 million that died of it. Why don't we focus on things that really kill people, like children have in the South Bronx having double the national rate of asthma? And the numerous other things that are actually killing people in our communities.
And it's up to us. That's one of the things with the community board. The agencies, we want them to be accountable, but there's so much that we have to bring to their attention. So the onus is also on us to make others aware and act on it. Monique?
So quick question, I probably know, DOH is responsible for the pesticide being sprayed?
I think it's DOH, and Department of Sanitation. Am I
DOH,
correct?
it's DOH that declares the emergency that allowed to circumvent this federal judge ruling. I don't know about Department of Sanitation. I'm not.
Who actually does the spraying? DOH itself? Who does the actual
Yeah,
spray?
so from what I
So
understand.
they don't involve
Yes.
sanitation. Okay.
And nobody's on from DOH tonight?
No, they didn't know. We're happy, we can bring them on, and Tiffany and Mitchell and Catherine will help us develop how, make a recommendation towards some policy. Oh, Edwin has his hand. Edwin,
Put it,
my hero there. Let's see.
it's in the chat.
Spring is to.
His hand is up too. Edwin? Edwin has written something, but, okay, I'm not sure if he can, get on, but we'll read his comment.
I can read it.
Edwin's in class. Edwin's in class.
Okay. That's why
Doing double duty.
my hero. Okay,
Luquita, you asked whether or not there were non-toxic alternatives that could be considered instead of spraying the community with such toxic stuff that's creating additional problems for the residents. You were asking a question, I don't know.
yeah,
what the answer-
piggybacked on, what Tiffany and Mitchell had brought up about dragonflies, bats.
Oh,
I don't know about bats, but anyway, the dragonflies sounded,
Oh, as an option?
interesting. And there's what fish, some fish, like, what was it, Mitchell? Or maybe Tiffany heard it,
Okay,
but
last,
there are other, there are alternatives
got it.
and recommendations that can be made.
The city should comply with its own commitments. Again, removing standing water. We also have situations where you have vacant properties that have become a breeding ground for all sorts of weeds that become trees over time. And there's no control or mitigation because it's just because of forest running water.
And Edward's comment is interesting. Of course, he mentioned this whole thing of the controlling the adult mosquito population, but spraying is typically part of a broader mosquito control strategy, which includes removing standing water where mosquitoes breed using larvicides and promoting the use of insect repellents by the public. So it seems like it should be a simple enough solution that
It sounds like sanitation should be involved.
it sounds like
Cleaning up areas where you have standing, debris that collects water. Period, in addition to other alternatives
And
that
I'm
could
wondering-
be explored.
And I'm wondering, is DOT, I mean, would that be in their area? Would it be more sanitation? Maybe that's the reason DOT is not responding, not to give them an excuse, but I know you reached out to DOT. Is there a particular reason for DOT as opposed to sanitation?
You described
They,
the
the street
indentation.
grading, right, a street grading issue.
Right, they accepted responsibility, they didn't say it wasn't
I
within
mean,
your
at first they
warehouse.
wanted to say it's a DEP issue with the catch basin. It's like, oh no, it's not the catch basin. Everything's draining in there. It's just that the street isn't properly graded.
Correct.
So therefore the water's just standing there in the street.
So maybe that's something that's something we can address with a resolution or a letter.
I would refer to uniform services
Yeah,
first.
we.
Right.
That's their area, let them
Yeah,
deal with that,
that's where we
then we can follow up.
start.
It's with
All
DOT,
of us.
it's with the committee, with uniform services.
Yes, we
Yeah.
placed many complaints,
Yeah, we
during that committee.
We just spoke to them, in fact, last week.
And I missed that meeting though.
Yeah,
You brought it up again?
I will bring it up because I have to send pictures about other stuff that I
Yeah.
had concerns about, so I'll mention it again.
And then we could send a note to,
Yeah, I sent pictures. He
support.
did send us one, but for comment, advocate, but not for singing.
Okay,
Well, there's additional problems, right? That the spraying, when you spray massive amounts of pesticides, as the city has been doing every year, it
Yeah.
kills the natural predators of mosquitoes faster, way faster than it kills the mosquitoes themselves. So there are all these studies that show that mosquitoes bounce back much more quickly. So that spraying is not the way to even address it. Right now, people were saying that there's a lot of mosquitoes around New York all of a sudden, and yet the city has been spraying every year. So how come there are more mosquitoes now than there had been in the past? And each year it gets worse and worse. So this is the wrong approach, a holistic approach, environmentally sensitive approach that deals with animals and birds and as well as human beings is much more important. And I went back, I was just writing up the history of the spraying in 1999 and 2000. And I had totally forgotten that until I reread this, that the city was blaming it and the federal government were blaming it on Saddam Hussein, believe it or not, and that this was sent by the president of Iraq to do something to people here, whatever. And it turned out to be ludicrous, but New York was able to get funding by saying they were fighting against terrorism to use that funding for the mosquito program back then. And so this is all convoluted nonsense, but the whole approach is wrong and the whole thinking on it is wrong. And much appreciate the community board's time and their willingness to think about these things, because it seems like everybody in the city has forgotten all this stuff. And we have to relearn it all over again. Thanks.
very interesting discussion. Thank you so much. And we'll be looking to follow up on this. In the meantime, Edwin, who always multitask, sent something, some of everyone's suggestions. Dump out standing water, put fish in ponds to eat mosquito larvae, use bacteria like, I think the word is bed to kill mosquito larvae in water, invite birds, bats, and dragonflies. This is what all you guys have said, plant mosquito repelling plants, use natural oils like lemon, eucalyptus, or lavender to keep mosquitoes away, install screens and mosquito nets on windows and doors, use outdoor fans to keep mosquitoes away, set up mosquito traps that use CO2 or UV light, and organize community cleanups to remove trash and water holding items. That's it's a lot, but it sounds doable. This sees the time element. Thank you so.
And there's one more point, is that if the city would increase the amount of garbage pickups, rather than leave these piles of garbage all around buildings, that would help not only with mosquitoes, but the rats and, but
Yes.
they're not doing that. So thanks.
Thank you very much. Thank you, Tiffany, for pulling this together so quickly for us. And Catherine, I am sorry that she did write in the chat. And I think Mitchell mentioned what you were discussing related to birds, bats, bees, dragonflies. So you got covered even though we didn't get to hear your voice. Thank you so very much.
Thank you all.
Okay. So our next area topic, let's see. Oh. And Tiffany, maybe we could talk next week, just to get an outline or something together. And then, of course, Uniform Services Committee to discuss the street grading issue. Thank you, Heather, for that, and Monique. One of the other things that got done this summer was a community envisioning project. We hosted for City College of New York's Joyce Freeling, who has a big project dealing with urban farming. I don't think Joyce is on the line. If she is, speak up, Joyce, so we can hear you. But we'll have her talk about it at our next meeting. But she has a major project that we will be working with her on, related to looking inside this district, which doesn't really have, to my knowledge, I believe she said an urban farm project. So we would like to see how the community board can play a role and be part of bringing that to the community. She's working with someone out of Boston to set up a therapeutic teaching kitchen. And that will be further discussed. It was basically some innovations in greening with a health focus on farm and food. Let's see what else in terms I can mention. She talks about focus on several projects, and this actually came up in the envisioning area. We had hoped to have at least 12 people. We had 18 people at this envisioning right in this room. So we were very excited about it. It was really an excellent presentation and participation of people. Number of the community was from the community board itself, so that was really great to see. She has sent out an app called Jato to enable contribution of thoughts, further contribution of thoughts using either text response, photo, or video. So we'll be hearing the responses that she will get or has already gotten from those participants, and therefore hear more from Joyce. She brought to my attention also that the last week in September is Climate Week. I'm not sure if we'll be able to pull something together, but possibly in October, first meeting in October. I talked to Dr. Gosh, who is a climate health, medical doctor connected with the Columbia Irving Medical Center, Columbia University Irving Medical Center. And so he would be very interested in addressing us, and so I'm hoping he can do that in October. Climate health, as an area topic. He worked, I met him through Dr. Julie's Gomez, and, Dr. Gomez has a health equity program that I participated in this year. It was really wonderful. It dealt with various ways that the community community board or community people can outreach and provide information to our residents on how to improve their health. So she couldn't present this time, but she will. And now what I would, let's see. I'll still give it a little bit more time before I go into sickle cell. But we have Maria Wheat-Track, and you can correct my pronunciation, Maria, who contacted our office, Madison, and who is our community educator, and asked if she could present on her violence intervention program. And I think that's Maria right there. So let me make you a co-host, Maria, and I'll take Tiffany and Mitchell away. Give me a second. I don't think so. Let me make sure I did that correctly. Why is it going to? Oh, I see. I should be up here. I should be up here. Okay. Okay, there we go.
Perfect.
Oh, your co-host.
Thank you. Can everyone hear me?
Yes, very well.
Okay, great. So thank you so much for your time and for letting us present here. So I'm Maria, and I'm a community educator. I work at a nonprofit called Violence Intervention Program. And maybe I'll just pull up a quick presentation to explain more of our services. Let me just try over here and you'll tell me if you see it.
Yes, we see it.
Okay, perfect. So we provide services for survivors of domestic violence and sexual violence. The reason I came here was because we are doing some on-the-ground grassroots outreach, specifically to the city council districts. So we visit City Council District 7, and they also reference that we might want to go to Community Board 9. And we took the opportunity, we went there, we talked with Madison, and she mentioned that maybe this could be an information that could be helpful for this committee, and thank you so much for the time. I don't want to take too much of your time, but basically what we do is that this is just a little story about who we are. We were founded in 1984. We work all over the city, but it was a Latina-led organization, and it's specifically trying to reach the Hispanic community, and that's also why City Council District 7 was so important to us to start kind of creating more direct outreach, because there's 41% of Hispanic population as of 2020, so that's very important. And basically what we do is that we provide counseling services. We have a helpline where anyone that is victim or that might be experiencing any violence at home can call. Of course, we have a tendency to serve women, but anyone can actually, just give a phone call to the helpline, and they will do like an intake process. There's a counseling services, there's advocacy services. The idea is to connect people with resources. There's emergency assistance. There's also the opportunity to provide shelter, emergency shelter, but also other forms of more stable housing with housing advocates that we have here. We, as I said, we basically tried to serve the Latinx community, but not only. And these are some statistics of what we've done in the past year. I wanted to also share that we did some research of what was going on District 7, and from the persons that are, I think Community Board 9 overlaps with District 7 and 9. But because we were looking at more districts, we saw that the New York Police Department precincts that cover most of the territory of District 7 got 1,365 DV complaints over the past year. So that's still, if you compare it with other districts, is a high number. We do take a lot of importance into reaching with cultural awareness, and because of all of our staff a lot of them are from the Latinx community. I'm also from the Latinx community, and we're very culturally competent when it comes to helping survivors. And this is just some ideas of why a person might stay, or like what are the barriers that make it that a person stays in a abusive relationship at home. You can probably read some of it. With the clients that we work for, there's a lot of language barriers, a lot of economic dependency, cultural pressure, of course, there are immigration fears, and a bunch of other reasons that maybe some of you are familiar with. And okay, so basically I said all of this. This is our services. We have the helpline. We have housing opportunities. We also have counseling and case management, economic justice program, which is also very interesting because a lot of the survivors might not have a stable income. They might not have even a job in their lives. So it's very important to have opportunities for them to start creating income out of the things that they know, because everybody knows like something, either if you have like, cooking or cleaning experience, this program will help the survivor turn something that they do into an economic opportunity. We also support victims of sexual violence. This can be someone that has experienced sexual violence recently, or someone that experienced it in the past and still has a lot of mental health crisis or support that they need, and they can come to us and they can speak with our counselors and have further services. This is also a very good program. It's called the Child and Adolescent Program, and this specifically supports children and adolescents that have been victims themselves, or they have seen violence at home. I think it's a very transformative program because it really goes into the generational kind of trauma or the generational attitudes that we might just normalize, and it really helps to support those kids at the moment where they need it the most. So there's that too. And we have a new program. This is called the Restorative Justice Program. Please don't quote me on this because this program is a pilot, but the idea is to how we can create within our own communities and with survivor-led ideas of justice that don't necessarily are punishment or might involve criminal justice systems. And last but not least, I am part of the community engagement program, and within the community engagement program, we try to reach out to like the community members, the people like this community board, that, you guys are the direct link with the community itself and with the resources. I do workshops with adults, with teenagers. We do workshops on domestic violence, but we also do workshops with teenagers on what is teen dating violence and how like certain forms of relationship abuse might manifest when we're very young. Also, we talk about other forms of more systemic violence, maybe like gender roles sometimes. We talk about digital abuse. And another workshop that we do a lot that might be of interest for this committee is elder abuse, which we have seen a lot too in other communities. So all of our programs and all of the information that I just shared is free for survivors. It's bilingual. We all speak Spanish. If we cannot, speak the survivor's language, we might try to connect them with other resources and other organizations. So yeah, our main goal was just to present this, and I think that's it. There's some links if you want to follow or if you want to know more. Here is the helpline. If you know someone or if anyone of the community members you serve might need any sort of support, they can just call the helpline. And I'm happy to answer any questions. I can also drop my email in the chat. And yeah, if you have any, school communities or caregivers that might be benefit from the workshops, I'll be happy and I'll be super grateful to know their information and yeah, to answer any questions. And thank you again for having me here.
Maria, you mentioned workshops. Do you have a published or publishable list of workshops?
Yeah, absolutely. I can send the link in the chat. And there's a request form where anyone can just request the workshop they want, and they can see all the overview of the workshops that we have. And again,
Okay.
everything is free, and either in Spanish or in English.
And do you provide housing?
Yes, there's the possibility of providing housing for survivors. I'm gonna be very honest, and probably this is something that all New Yorkers know. It's not an easy process. But yes, there is the possibility of having emergency shelter. It depends on the availability that the shelter has. We have our own shelters, so it's not New York City shelters. But yeah, there's that program, and then there's another program that will help support the person in securing more stable housing. If they have a voucher that it's not, kind of situations of where you have a voucher and they don't want to accept it, or if you're just not sure how to look for housing, a housing advocate can help you navigate that. But for emergency situations, there is limited availability, but there is a possibility, yes.
So if someone runs to you, happens to know about where the office is and all of that, and they need to get away from their situation, you can provide something to them in secrecy where they can be protected.
Yes, exactly. The shelters are all
Even though they're called shelters, it's different from the city.
yes, they're different from the city. Yeah. Yeah, they're different from the city, and our locations are private because of the nature of the work.
Right.
Yes, but if anyone needs any sort of support, the first step is to contact the helpline, and I'll send the links on the chat so you have the helpline available to you. Yeah.
And do you have a relationship with other violence prevention or intervention programs? Or are you working pretty much as your own agency?
I think
I'm thinking like Women in Need, they were one of the first, I think, in a setup like yours from years ago. I'm just wondering, and you don't have to have, I'm just curious.
yeah, I wouldn't have that information precisely, but I think I could get an answer.
No, I don't need to have it, I'm just asking a question, if you have a interaction with other
Violence
Women in Need agencies. Say
Oh,
if
we
you-
definitely have very close relationship with other women's agencies working on domestic violence and sexual violence. Like for teenagers, also we work a lot with Day One. I don't know if folks are familiar with them. They do a lot of
Say that again, we had some noise. Which agency was that you just named? For
Day One.
teenagers? Day One.
Day One is for teenagers and intervention for healthy relationships. There's also another organization called Saki, and they work for Southeast Asian women support, and Arab women too. So yeah, we have different
Wow.
relationships with other communities. And I mean, I myself might not know exactly, but the counselors definitely do have way more resources to support.
Are you finding that from last year to this year or 2 years ago to this year that there's an increase in domestic, in violence, and the need for shelter? Just curious.
If there's an increase,
Just over the last couple of years or?
I think definitely there's an increase in housing needs in the city in general. But I wouldn't know if it's specifically, like what specificity does it have with domestic violence. I do have some numbers if you are interested in how many clients from District 7 have been getting resources from VIP for last year. And not everybody gets the same kind of support. Some people just get mental health support here. Some others in like less amount get support with housing or with economic opportunities. So it varies. But
Okay.
yeah, definitely there's always like a housing need in New York City for sure.
Sandy, did you have a question? I saw your hand up.
Yeah,
You're on mute.
hi. Thank you so much for that presentation. It was along the lines of how you partner with other organizations. I know in Washington Heights, we have NIMIC, the Dominican Women's Center, and others that work on domestic violence prevention program. And to your point, in terms of the number of increased lack of services in the area, I know that we have identified a great issue because a lot of these cases really require legal representation, and that's something that we're working on to really provide comprehensive services, sort of closing the loop in order to actually meet the needs of this population, which is ever so growing. But we do have a shortage of attorneys that can help us in that process as well.
Yeah, absolutely. I agree. Thank you. And unfortunately, we don't have legal support here at VIP, but we do have, connections with the Legal Aid Society, for example, which are the ones doing great work, and also Court Innovation, the Urban Justice Center. So yeah, and then definitely we're trying to grow, and maybe at some other point we can talk more about it, like the restorative justice program here, our own little organization, because it was actually an initiative that it was brought up by the survivors themselves, because there's so many layers of difficulty of, sometimes you don't wanna, for X, Y, and Z, you don't wanna get involved other institutional power into the most intimate relationships you have. So yeah, definitely, if the person needs legal support and they call and they have an intake with us, the counselor has to provide them with other resources for other needs that we might not have the capacity to do so.
There's another hand, I can't see the name with it, so just, speak out, if I see a blank, you see that hand, that?
I see they have, I don't
No,
see
that's
that.
from your,
Oh, that's from mine?
Oh, it really sign here?
I can't. Thank you, because I wouldn't know that, I haven't seen that before, okay. Monique, did you have a question? I'm not sure.
No, I think it was answered, though. It's good to hear that they are, look, two things, because I know in this committee, we talk a lot about mental health and how obviously if you're in a toxic relationship that that compromises one's, or works on one's ability to be healthy, whole, and mentally. And so I'm glad to hear that that's something that is also part of a holistic approach. And then you talked about legal services. I thought you made a good point, Laquita, in terms of like maybe the other organizations too, because we had someone come before and speak. I'm trying to remember which
We've
organization
had
it
a
was.
couple of
Well,
violence intervention.
Yeah, I remember one. I'm not sure if there were two, and just to make sure that the dialogue is open so that they all are working together collectively to address this scourge, because, it's a terrible thing. So thank you so much for the work that you're doing, and knowing that women and men have a place to go that's safe.
Yeah. So, any other questions for Maria and her service, the Violence Intervention Program? Well, one other thing, how long, and you may have mentioned this, how many years or how long have you been in, has your program been established?
Yeah, it has been around since 1984. It was first part of another organization, and then it started being its own organization, its own, yeah, nonprofit. But it's
And,
years.
and you seek funding, correct? You get else funding, or is it part of another agency?
Sorry, I couldn't hear.
You get funding, correct? You seek funding as well?
I think the organization gets funding from various sources, the city, and then some other grants.
I was just wondering if you have any interaction with West Harlem Development Corporation.
They did mention, I think so. I think we do. But that's above my pay grade. I don't know that.
That's okay. We get a
To be
lot
very
of-
honest, I believe we do. I believe we do, yeah.
We get referrals from them, so I just wanted to make sure whether or not you had a referral from them to come to us. So, no, this was on your own, so that's good.
Yeah, there's definitely
That matters
an
to either
initiative
one.
from the community engagement department, and yeah, no, I think community board meetings are, super fruitful. I've already learned so much about mosquitoes and spray. So yeah, thank you for having me. And I'm gonna drop my email in the chat. And I apologize, I have to go to catch my train, but thank you so much.
Thank you very much, and come back at any time. We're moving forward. I noticed my friend Audrey Adams. I hope Audrey can hear me. But earlier, when Victor, our chair, Victor Edwards, was talking about the community board and his interest in health and environment, he mentioned our sickle cell project, and of course I had Audrey down, but it was a project that came to us from one of our discussions, having heard in November of last year that a major discovery in gene therapy had come about for sickle cell survivors. That we decided we wanted to do something more extensive, particularly since in our community, largely people of color have, those that have sickle cell come from that population, people of color, particularly Blacks, and I think in the Latino market, but there's also among Asian women as well, and maybe even in the Mediterranean. So we didn't know how extensive it was, but we wanted to get the information out to our community, which is extremely diverse. And so the idea came about to develop something where it could be and use media to get this story out. And in talking to Dr. Olajide Williams at Columbia Irving Medical Center, he mentioned perhaps we could, if there's a video, it could be presented in our hospitals, in our clinics inside the hospital. I mean, he thought of this wide range way of communicating information in an interesting storytelling way. So Audrey was the first person I talked to. She loved the idea. She's here with us, and from what I could hear the sample, it's really terrific. And Audrey, Victor mentioned his good friend Montez Davis, and I know you had a great conversation with her and some of the doctors involved as well. So if I'd like to introduce everyone to Audrey Adams, who has the Audrey Adams Report. And you could tell us about radio and television outlets that you reach out to. It's just really wonderful what I saw of what you've done. And I hope after all of that, Audrey is there still.
I'm here. Can you hear me? Great. Thank you very much. I learned a lot I'll tell you that much. It was a wonderful opportunity to be able to speak with Dr. Cheryl Mensa and Dr. Suzanne Curtis, and of course Montez and her daughter, Sarah. Yeah, it
And
was good. It was
Yeah, and
really good.
I think Dr. Mensa, Mensasah, is
Yes.
with, oh, what hospital is she with? She's uptown, but she does individual, she works in a clinic as well.
Yes,
with
she
sickle
does.
cell.
Yes.
And, or you just mentioned Dr. Suzanne Curtis, who was connected to Mount Sinai.
Mhm.
Actually, I learned of Dr.
And then
Curtis through Monique's contact, the first contact with Dr. Oh my goodness, I just fucking like too many doctors. Yeah. But anyway, she's at Mount Sinai. And I'm not sure if you've had a chance to go the next step. You don't have, and it's really thorough, the ones that you've talked to thus far. And there was a very emotional, heartwarming moment with Montez and her daughter.
Oh yeah,
Yeah.
it tore me up. It just tore me up. But so the shows, the television shows, are actually going to start airing this week. So what I did, I broke it down into a series of 3 different interviews. So they'll run throughout the month. They'll run on my television show, which is Talk with Audrey, and that's syndicated nationally. I reach more than 2.5 million people every week with the television show. And then my radio show is on, it's also syndicated, but it's on in New York on WPAT every Monday for an hour. So I am running, I'm starting the show off with Dr. Mensa. So her television show will air on, let me see, the 15th, and then the radio interview will start to air on the 16th. And
Okay,
that's
so-
going to be followed the following week by Dr. Suzanne Curtis. Susan, I'm sorry. Please forgive
Suzanne.
me. Suzanne Curtis. And then to wrap it all up is Montez and Casaro. So they are, yeah, the television show is 28 minutes, 30 seconds. And the radio shows are an hour.
Can you send, can you email something so I can get it out to our board and, yeah, because our board meeting is on the 5th, not this week, but next week, so, it's so we can get the information out. I know.
Yeah, I'll send you, yeah, I have a graphic that I'm working on that I'll send to you that you can then forward to your board.
And then, she didn't get to interview Victor, but she has an introduction about the Community Board 9 and how.
Yeah, y'all want to know what I said? Hold on. Pull up.
No, but she's mentioned our board, Victor, and, the Health and Environment Committee.
Audrey, quick question, is it streaming? How do we access the TV portion of your show?
So, in New York, I'm on Astound, which not every, that network, and not everybody gets that. So there is on Sunday, I'm on a network called Biz TV, and they actually stream live. So you could just go to the site and see the show. And I could put that information in there and a link as well, if you'd like.
Yes. But also, when do you think you'll have your graphic ready? No pressure, but I was thinking we could all.
Thanks. I appreciate that, Laquita. I appreciate that.
I was thinking that about, together when we send it to, the community board 9, and to everybody, and to announce to everybody. Yeah.
Right, yeah. I'm hoping by tomorrow. I'm on deadline right now. So let me tell you what I said. I'll do it for both the radio and the television. How's that?
Okay, great.
Okay, all right. So I said, if you want my exact words, and I'm sorry, but I look a hot mess because I've been working all day and I'm in California. So what can I say?
Okay.
All right, so I say, well, you're watching Talk with Audrey. Welcome back. Manhattan's Community Board Nine's chair of the Health and Environment Committee, Laquita Henry, reached out to me to help them raise awareness, dispel myths, and foster a supportive community for those affected by sickle cell disease. The Health and Environment Committee plays a vital role in monitoring and addressing the social determinants of health within the community and to nurture a healthier, more equitable West Harlem. As a resident of New York City and the community of Harlem, coupled with my commitment to provide information every week to help people improve the quality of their life, well, you know me, I had to dive in. So I'd like to thank Laquita and the chairman of Community Board 9, Victor Edwards, and District Manager Yutha Prince for working with me to present a series of interviews with doctors and a survivor of sickle cell disease. You'll meet Dr. Cheryl Mensah, assistant professor and co-chair of the Sickle Cell Research Work Group and a hematology and oncology specialist at Northwell Hofstra Zucker School of Medicine and attending at Phelps Memorial Hospital. Dr. Susanna Curtis, assistant professor of medicine at the Icahn School of Medicine and the assistant director of the adult sickle cell program at Mount Sinai Hospital. And then a sickle cell patient, Montez Davidson, and her daughter, Kasara, shared their journey with me. And then I introduced the first segment with Dr. Mensah.
Okay.
They're quite extensive. So because the television show is a half hour, the radio show really gave me an opportunity to play it in its entirety. So for instance, Dr. Susanna Curtis and I were on the phone for probably 45, 50 minutes. And Montez and Kasara likewise were on for quite a while with me as well. So, the radio interview gave me an opportunity to run it in its entirety, whereas the television show is an abbreviated version of what we spoke about.
Okay.
But I can assure you that everybody gets at least 20 minutes on TV show, okay?
The sample that you did, the test run, sounded wonderful. And I think Victor heard part of it, maybe at the end.
Yes, I did.
It was so well done.
Oh, thank
Really
you.
well done.
Well, I like what I do, and Laquita, I've been in Harlem for a long time. I was on WHCR for many years, and then I moved over to WPAT, and at that point is when I started to really syndicate my show nationally. But I've always, my heart's with Harlem. As you know, Laquita, I've been in California caring for my parents, so. But that doesn't. But my heart is still there, and
Yeah.
and so when you called, I said, "Of course, Laquita. What do you need?"
Thank you. And it was just really a wonderful presentation.
Thank you. Well, I'm looking forward perhaps to working with you guys again. I will, without a doubt, keep you.
We'll have
get those graphics over there. I know you're coming back, Laquita. I know.
Yeah, we'll have another. Now, also Audrey, even though we know people at WHCR, she put me in touch with Curtis Archer also. And we had to cancel one time slot that he had in summer with for a number of reasons, people not available. So we're on his calendar for something right now with sickle cell. And the taping would be on a back to Fridays. In the summer, he had moved it to every other Thursday. Like it just got a little complicated. But we're hoping we can set up something with a couple of the other doctors dealing with sickle cell as well. But a different angle. So that's in the works. And then we have a number of topics that are hot topics that our community needs to hear about. And we have really some terrific physicians in our catchment. And so it would be just wonderful to have you, we'll reach out to you again, Audrey. And I think you'll enjoy as well. I know we don't want to work you too hard, but I like that you like what you do and you like the health arena.
I do, absolutely, absolutely. So again, it was my pleasure. And I thank you all for the opportunity. And well, let me know what you think, okay?
Okay.
Like I said, it's going to run all the way through the month. Everybody gets both a television and a radio interview. So I got all the bases covered, and yeah, I'll be in touch.
Okay, and so we'll hear, well, if you don't have the graphic tomorrow, let's say by Thursday is still a good time. Give me a couple more days, if you need it.
Yeah, I would like to have it done. I'm doing a graphic for each person, right? So the graphic that I'm going to have tomorrow is going to be for Dr. Mensah for the television and the radio.
Okay.
And then the following week I'll have a graphic for Dr. Curtis, television, radio, and then Montez and Casaro.
Okay.
Okay.
All right. Well,
All right,
yes.
guys. Have a wonderful
Thanks,
evening.
Veronica.
Thank you for all the work that you're doing in the community. I was happy to be of service.
Thank you again.
Thank you.
All righty.
You're
Talk
very
to you
welcome.
soon.
Absolutely. Bye-bye.
Bye-bye. And so we'll get out a little bit early because I know we actually needed more time than what I gave them, to come on with us this evening. But I'd like for us to hear from our vice chair, second vice chair, Monique, just any update on cannabis, what's going on with cannabis? Well, I mean, you give us an overall overview. And then I'd like to see if online, Deborah always has something exciting going on, Deborah Levine. I'm not sure if, well, Sandy mentioned one or two things, she might have something, and then Dr. Ronstrom, give a brief overview if there's something you want us to know in terms of what you're working on, trying to see who else, oh, and Dr. Maritzi, but I'm not sure if, I know we have a project, but anyway, Dr. Maritzi, if she wants to add anything in terms of the bio bus. So that would be, the rest of our agenda. Okay, so Monique.
Well, good evening, everyone. Welcome back as we begin the community board calendar for the fall. And as mentioned, second vice chair, but also co-chair of the Cannabis Task Force, for those who aren't aware. And I would state that our last meeting in June, we had a discussion that essentially focused on two things. One, we talked about addressing the closures of a lot of the illegal establishments throughout CB9. And my understanding, and I think of course it's been in the news, that there's been a greater crackdown in terms of closing down a lot of those places. And of course, we tried to remain vigilant. I know one of the areas particularly of concern for us was one that looks very lovely. It's on St. Nicholas, and it looks really quite lovely. You would think it's legitimate. And I believe it was closed, and I think it might be reopened, but we're trying to keep our eyes on that location. And another location on Broadway too, around 145th, or between 145th and 144th. So we do have our eyes open in that regard. I also know during our conversation, we talked about trying to have some type of educational forum, a forum that could focus once again on the medical benefits of cannabis and talk about how people can possibly access a card, a medical cannabis card. Because once again, we want people to be educated so that they might not, of course, be tempted to go to places that aren't vetted. And we know that there are challenges even to get information about providers who could advise people in the community. So we're gonna work on setting up something and possibly having it at a location in the community so that we're meeting people where they are. So more to come. And we're not doing anything this month, the month of September. We want to give ourselves time and look to do something of that nature in the fall. So just keep your ears, and eyes open. So those are my comments.
Thank you.
Quita, thank you, thank you.
Hey,
Monique.
Monica.
How you doing? So I just want to speak to this issue.
Okay.
We need to educate our community about marijuana.
Yes,
And the effects of it, because
yes.
we believe that it's not addictive, that it has no effect on us. There's a reason why people smoke it. It makes them high. I see a ton of young people who are smoking marijuana in front of their children, babies, 3, 4 months. And they don't realize that, yes, it's legal, but there are long-range health implications to that. So I don't know if we can maybe not only do community education, but we need to encourage the health department to do ads, just like they do get your flu shot, get your COVID shot. We need to have health professionals do ads, educating the community on the TV stations about the long range health implications for smoking marijuana.
Good idea, Monica.
Long range, okay, got it. And once again, I'm always talking about this in all the meetings that we hold. In terms of increasing visibility around issues that we're addressing, that's something, once again, that we can use the kiosk to put messaging up.
Yes.
To make it easy for people to
Yes.
see. So I
Yes.
totally agree with you,
Yes.
Monica,
Yes.
that we can do something like that as well.
Right.
And I've made a note of it. Deborah is on, and she'll speak in a moment, of course. We try to do a lot of things in collaboration with Deborah, who's got boots on the ground.
Yeah.
Is doing a great deal to educate our community, from gathering data to hear what people's concerns are, and in using that data as feedback so that we can determine how to be strategic in terms of our outreach and what we need to do. So I appreciate that. We all appreciate that. And certainly when Deborah speaks, she can add to anything that CUNY is doing.
Any questions on cannabis and what the community board its role? Okay, if I don't see any, just speak out if because I may not see a raised hand. Okay, since we're on the topic of cannabis, Deborah, can you, I know as mentioned, you have a lot of terrific health education items, classes, film, all of that going on. If you have something you want to add to the cannabis or to talk about with your programs, feel free to do so now. And thank you for all the help you always provide us.
It's our honor and privilege. Good evening, community board members and special guests. My name is Deborah Levine. I'm the Community Engagement Officer for the City University Graduate School of Public Health and Health Policy. Thank you, Monique, for always including us in these hard conversations. To your point, the school has embarked on doing a cannabis equity series that has focused both on understanding the legislation overall and also a focus on medical cannabis and a sort of focus on prepping the next set of public health leaders to be cannabis ready. And I say that because this isn't alcohol, it's not pharmaceutical drugs. This is a very different sort of beast, and we've got to be sort of prepared to have these ongoing conversations. We did do a series last year of cannabis equity webinars that are on our YouTube channel, and I'll drop the link in there. They are free. They have everyone from the Office of Cannabis Management talking to looking at workforce development issues, to our last series being with Dr. Douglas Charles and Dr. Maurice Henson, both a pharmacist and a medical doctor, talking about the implications of medical cannabis. We plan this fall to continue that series, to begin to talk more about the impact and also about some of the research that we've been doing in community boards 9, 10, 11, and most recently including 12. What I will say is that this summer we, along with some students and some faculty and community members, re-walked some of those communities as enforcement was being implemented, and we are happy to report that quite a few of the shops that had been operating are closed and have remained closed as such. We will be coming through those 4 community boards again to do some spot checking in the places that we saw some of the highest sort of clusters, to see what's going on, if it's sort of like close one shop, open up somewhere else. So hopefully by the end of the year, we'll be able to come back and report out what those findings are. But the good news is that I think more and more community members, community leaders are interested in having the conversation. So keep talking, and we'll keep creating spaces where we can have conversations about next steps. How do we work with the dispensaries? What does saturation mean in a community? What's the next set of licenses that are coming out? How is that going to be impacted? And what sort of support does the community get to be able to better understand? So I will drop the link to our YouTube channel in there. All of our webinars come with continuing education credits. So, and they're free, so feel free to share them. There's ones on mental health, cannabis, public health 101s, a variety of webinars. I do want to also just really quickly let you know that this Thursday, the school is doing a blood drive. So if you are eligible to give blood, we still have about 15 slots open. I hate to say it, but the city is in really bad condition in our blood banks, which has an impact on our hospitals. If someone is hurt in needing of a transplant blood, we want to make sure that our community members and our family members are able to get what they need. And so just know that every donation has the ability to save 3 lives. So I encourage you, if you can't give blood, to pass this on to someone who may be able to come in. The school would like to be able to support this initiative going forward. And being able to do this on a quarterly basis, because we want to be able to support the New York Blood Bank and making sure that we have what we need. So there's a link in the chat for you to register. So please, 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 if you have the time, send your staff, you come. We're taking walk-ins also. Happy to give up my spot if someone needs it for that time slot, and I'll slide in somewhere else. Just really quickly, also on September 25th, the school is doing a gallery walk, which is working with the School of Medicine at Mount Sinai, looking at cancer and at the risk. And we have students who have put this gallery walk together. So I would encourage you to please come stop by the office. It'll be up from 5 p.m. to 7 p.m. We'll have some light refreshments. But it's a really great exhibit done by medical students and our students at the School of Public Health. So thank you, and I look forward to a new year of being able to be a part of this committee and supporting you in any way that we can. So thank you.
And I know, Deborah, that sometimes you send information to the office, you could get that out. And I know that I've sent out to the committee a couple of things that are very specific. So we try to get the word out, and we really need to get our website, I think, really up and more notice, so we can get more so much of our information on that. And also so that people know that it's there, you know, so, but at any rate, keep, if you could send something on the young people with, in the tour, the cancer.
Yes,
exhibit
I
tour,
just dropped it in the
that would-
chat and I'll make sure that I resend that out in the email to the
If you send it
office.
to me as an email, then I'll get it out. It'll be easier for me to do that.
Yep, I
Thanks.
sure will. I'll put it all together in
Okay.
one email for you with the flyers. Just one last thing also is the Sexual Reproductive Justice Hub has been officially launched under Billy Avery, Dr. Billy Avery, who, for those that know, is the mother of the Black sexual reproductive justice movement. And so it is the first in the country and we have it at our access. We'll be bringing in new faculty specifically to address that issue. And it will encompass everything from body autonomy to legislation. So we are super excited about the launch. It is not something that is city or state funded. The dean has made an active decision to ensure that that funding stays separate so that it can be used to do what it needs to do, which is educate our folks and advocate. Thank you.
Thank you, thank you. Maybe we could do something with film here. Anyway, that's up for discussion. But even here, if there are 25 young people or at the Graham Wyndham site, you know, where they have classrooms, show some of these films that are available.
Absolutely.
Okay, Yana, Dr. Rhinestone,
Thank
thank you for being with us.
Yeah, thank you so much for having me. Yeah, so I'm Yana Renstrom. I am a former, now retired OBGYN. Lived in the city for 42 years, originally from Finland. I run CODA Alliance, which is a nonprofit for gender equality and women's empowerment over at St. Nicholas Place and 152nd Street.
And they've been a terrific partner with us, especially our public health forum. Sorry to interrupt. I wanted to interject.
Thank you, Latoya. I just wanted to tell you a couple of things and then request your help with one thing. First of all, we've started up our programs again. We mainly now focus on community service in the fields of art, the arts, and we're having an art exhibit coming up, looking for artists right now for November, women artists and youth. The other thing is health and wellness. And so for instance, we just started up our yoga classes, which are free and in collaboration with Harlem Wellness Center. We did them last spring also, and they were quite popular, so we're continuing with those. We like to do things in collaboration, not competition with other organizations. We have other things, you know, coming up. So they're all, of course, on our website, and you can follow us on social media to find out more. Just briefly, next week there is a potluck, which is part of our holistic health programming. Although the yoga is just for women, the potlucks are for any gender. Then the week after that, there's on the 25th, in the evening from 6 to 8, we have an entirely Spanish speaking event. There is a midwife from Peru who is in town talking about, like, you know, Andean cultural approach to birthing. And so we're doing that entirely in Spanish. And the purpose is to basically inform people about it, as well as to try to interest Spanish speakers to become doulas. And this is the other thing which I would put out a request there for you, because we are last spring we had the opportunity to apply to the program by Columbia University, which they are looking for community organizations to conduct community-based project research. And so we were 6 groups and we had to take like a whole course during the spring in how to conduct community-based research. And we were like 6 groups with 6 different projects. And so we were given guidance on how to apply for this for a grant for $30,000. And so we have like a 50% chance because they give out 3 of those grants. And our project is to research the impact of doula, the presence of doulas in births. Now, there is information about a lot of benefits of doula care, but not that much from our community here. So it's going to be a qualitative research study with interviews with patients or women who have given birth recently. So since it's not going to start until next year, this means women who are currently pregnant or who just had a baby this year, whether or not they had a doula or not. And the thing is that there is so much need for doulas. You know, it's only like, it's increased a little bit, but it's only 6% citywide. In this area, it's about the same, but among Hispanics, it's only like less than 2%.
We had a presenter on doulas, I think it was 2022, but we need to do more of others and more. And at our March Health Forum, Edwin introduced us to, again, there are too many names now, but a doctor who would be a good contact for us, and she spoke at the forum.
Yeah.
And we probably could be in contact with her too, because she knows doulas. And then we did a resolution supporting Governor Hochul's funding. I forget how many millions, but also making sure that doulas would be available for even people who had Medicaid.
Yeah, so Governor Hochul approved Medicaid funding for this in January.
Yes,
There's
yes.
some rollout problems with it, but I think they're fixing that. I mean, just like payment problems, yeah.
Right.
So that's at least an issue that is being addressed, but there's a lot of, for the different cultural groups and immigrant groups, in the city, there aren't enough doulas, and their retention rate is very low. Because there's other issues that interfere, so people get trained and then they drop off. But it is actually a great, thing for workforce development, because it's a skill that you can learn quickly, you don't need a lot of education.
Well, there's also someone who's training in nursing, and they're training doulas also. I'll have to pull up that information. We'll have to organize a presentation here, but meanwhile, let's talk so I can get that information to you, and at the same time, send it to our committee again, so we can do referrals.
Yeah, that would be great. And so the thing is that in order for it to be a really well-run community-based research, we need input from the community. And so we need like a small advisory committee, and we have a few people for it already, but if any of you work with these types of people or have experience with pregnant women and mothers with small children who have recently given birth, if you would like to be on that committee, I don't think that it's very much work right now. It's going to be mostly like helping us formulate the interview questions so that they're appropriate and relevant. And then perhaps connect us with interview candidates, because these are going to be women who are very busy with their small kids, and probably not easily, accessible. We have to go to them,
Yeah.
But however we find them, I'm also going to interview some doulas and some OBGYNs to get a full picture of their experiences basically. And the position of the advisory committee is going to be compensated if we get the grant. So we're going to try to put in a good grant application. And for that, we actually need people like right now, because the grant is due in October, like late October. So if you're interested in this, please contact me. My name is Jaana, Jaana, at kotaAlliance.org. That's KOTA-alliance.org. And Laquita has my information. So.
Yeah, maybe we could talk to if any of you, I know, Justin, you're interested in yoga, and I don't know if there's, you teach yoga. Yeah, so there's, maybe there's a way, is there yoga for women in maternity?
We haven't done that yet, but if we find a qualified instructor, we'd love to offer that.
Okay.
Are you in touch with any of the daycare centers? There may be parents that they may have children in daycare, and sometimes I know I've seen pickups, they're pushing a stroller as well as kid that's walking. So
yeah, I think we're gonna start looking there for sure now.
I have to reach out to the doulas who came here, and Right. Yeah, there were a couple of groups that talked about doulas and providing them, but I would imagine retention is an issue. Okay. Thank you so much. You're very welcome. So we'll be in touch. Dr. Milano, do you have anything you'd like to share that's going on? I know there's always a lot from, if you don't this time, maybe October, but you know, just, I wanted to mention as well. 'Cause
Yeah,
there are a
so
lot of
there's,
stuff.
there's nothing going on, although, as, I think CJ put it into the chat
Yes,
that there's going to be a
that's
health fair at the corner of 145th and Amsterdam. Emma Bowen is they are the people who actually initiated it. We will be there. There'll be health screenings. There'll be a mammogram van, and so on and so forth. Yeah,
What's the date of that?
Is it this Saturday?
I think it's this
No,
Friday. I think it's
next
Friday.
Friday, September. CJ, do you wanna speak on this? But anyway, it's September, he did drop it in the chat, I see it now. Next Friday, September 20th at 1727 Amsterdam, right on.
1727? Okay. You got it right at the corner, 120, 145th, yeah. And Amsterdam.
11 AM to 4.
Correct.
And it will feature screenings like mammograms for women 40 to 75, prostate cancer screening via the PSA blood test, flu vaccine, HIV testing, Hep C testing, and more from community partners, including Heritage Health, Bryan Health, Mount Sinai, and the American Italian Cancer Foundation. So that's next.
So they're gonna be outside?
Do you have, you know what, they sent a flyer, I'm gonna look for that, or make a notation, I sent it around to the committee, but we need to send it to the board. So, CJ, I don't know if you've updated your flyer or not, but otherwise I'll forward to Victor, or to, youth, and Akil,
Yeah, so.
that information.
Can we post it on, I always say the kiosk, but
Yeah.
It might not be enough time, but at least, it may not be enough time, but you could try having it posted on the, Link NYC kiosk. You know, that is a possibility. Let's see, who
Yeah.
else had I?
Yeah. Mhm.
Okay, anything else, Dr. Milano? Thank you for.
No, next month
bringing
we'll
that
have
up.
new news. Thank you.
Okay. Thank you, Victor. And so I think that's, was there, I think I mentioned four people. So I think we've touched on everyone. Diego from Columbia University. I don't want to put you on the spot, but you know, if there's something, 'cause I know there's a lot of activity there.
Yeah.
Or Sandy.
Yeah, I just
anything
wanted
else you might
to,
want know about?
thank you. Thank you so much. I will send you the flyers and report, but I did want to highlight that on September 19th, we've partnered up with Abbott Elementary and the Science Cubes. I know it's gonna be great. So we're hosting what is called a Curiosity Cube, which is really bringing out the sciences for a pipeline programs. This time around, we are partnering with elementary schools in the area. So we have a fun-filled day filled with science and experiments. And in this lab, this cube actually goes all around the country, sort of giving kids an inside look at the science and sort of awakening their curiosity. So we're gonna have a big day on campus with that, and I'll send
What
it.
time is that, Sandy? What time?
Yeah, it will be from 11 to 4.
Oh, that sounds, okay. These
Yeah.
are 2 different days, that's good, okay.
Yes, and then we are also on September 21st, we're having our brain health fair once again. So we'll be sending also flyers to that, along with our Seniors Aim High program, and I'll update on the next meeting about this program. It is a seniors fitness program that we run with our partners at the Armory Foundation. We have over 475 seniors that engage in physical activities and a series of talks with our doctors and residents on health and wellness. I was going to be thrilled to inform you that the seniors are preparing, watch for them on WPIX. They're doing the Thriller dance on October 31st. These seniors are very serious about their wellness. So we will be coming up next month to the board just to fill you in on that, and also to really stress the program is ongoing. Seniors are free to come and register anytime. We started with Tuesdays. We now have 2 days, Tuesdays and Thursdays of fitness at the Armory. So feel free to stop by and enjoy. And lastly, I know, Lokita, that you received the flyers, but also on the 21st is Neighborhood Appreciation Day. So it's our annual football game at Bakerfield, where the entire community is also invited, and hopefully with the community support, Columbia will try to win at one of our games. So we welcome we're begging to
Okay.
get a win.
So, Sandy, do you mind, you have what you announced just now, you have in flyer format?
Yes, I will send you all the flyers so you can please
Is
distribute.
there in one email that would really be good? I'll just do an introductory and we'll get that sent out to our board members as well.
Great.
So
We're also,
that's
I will
just
send
wrong.
you that along with we're also having on the 26th, our presidential forum on the health issues, the health impact of this election. I will also send you those flyers.
Wow, yeah, that'd be good. Okay, yes. So if you can do it tomorrow, that would be good.
I will do it right now. We have it
Okay.
because I
But send it to my email, if you can send it to my email address. You can
Sure.
drop it in, of course, here, but
Okay,
it'd be good if it was sent to my email address.
will do.
Okay, and Yana, Edwin sent over the name of the doctor who spoke at our forum, where is it? Dr. Camilla Barnes. She was the one who spoke, and she talked about doulas, and it's what she does. I think she is in contact with a number of trainings and also can assist with training.
Yeah, I know the name, I've never met her though.
Yes, she was part of our health forum also.
Good.
We learned
Yeah,
about her
that's-
through Edwin.
okay.
Dr. Camilla, Kamila Barnes. DNP, RN, and FNP -C. Yes,
I can't
Barbara.
see from here, the lady that spoke about the seniors and dance, fitness, I think.
That was the one who spoke was, it was Sandy, Sandra Harris, I said Sandy, Sandra Harris. And Sandra is with Columbia University, Irving Medical Center. And the Office of Community and Government Affairs.
It's actually the Office of Academic and Community Partnerships. Yeah.
Okay, alongside of it, yes. Okay.
We keep moving, we keep changing names.
Okay. Anyone else with comments, announcements? See, everyone we have really a great, cadre of just expert, wonderful people with expertise. So in the health and environment field. And so keep coming, keep being among us and sharing information. And we'll just find a way of just making sure that we get the community out and get this to the community as rapidly as we can and broadly as we can. I think that will wrap it up. I know that our agenda always looks to be longer than it is, but we carry over resolutions that are so important, and there's a need for accountability, but we have it there so you can see the kinds of projects that we've worked on, the policies that we're encouraging. And a lot of it means following up. And all of these resolutions, of course, get signed by our chair and sent to our legislators, whether they're not so much district leaders. I don't think we've sent as much to district leaders, but city council members, even those that are not part of our district, because we know that there are city council people who chair a particular committee that needs to have this information. We send out to, of course, the mayor's office, the governor, Health and Hospitals Corporation, if need be, Department of Sanitation, Department of Health and Mental Health. And there are, subcategories as well. There's one person I needed to have had here and I forgot to refer to my own notes, and that's the person who presented to us on the 988 number for suicide and crisis lifelines. I'm gonna see if he'll be available this October, because Monica had given me an incident that occurred and she had called 988, but it really was not the kind of response that we would expect. And I think that there's problems with the practice of it. It's good in name, but we need to inform them of what's going on in terms of the practice of using that 988 number and what's been happening. So they need to be aware, and if they're not aware, they can improve. But they probably should have some way of being aware, but they need to know that the community's watching. Any other comments or, it's Barbara, right?
Yeah, I know, I'm new here.
That's
Which armory was, is,
it's the Armory at 168th Street, right? So let's see, I don't know if Sandra got off the phone oh, there she is.
she's done.
It's the one at 168th and.
Yes, it's 168 in Fort Washington.
Washington.
So
Yeah.
you seniors can go straight into the armory and sign up, or they can feel free to reach my office, and the number is 212-305-8060.
Repeat.
212-305-8060.
Okay. All right. Any other questions or comments? Yeah, so we have done well. Is it 8? Am I eyes 8:37? We've done well. Thank you so much again. You'll hear from us. And Edwin, my friend, I don't know if you're still in class. Thank you so very, very much. Edwin is former co-chair of this committee over a number of years through this past fiscal year. And he is now, he's in school, working on his MBA. And so he's hard working on that and following receiving his doctorate and, well, of course, yes, doctorate, and maybe in some other achievement, academic achievement as well. And so I appreciate his great volunteer duty of taking the minutes for this meeting. And contributing always. Thank you so much, Edwin. Okay, he's in class, yeah. Okay, thank you again, and the meeting,
So we're
we'll
calling the
have,
meeting
I was just gonna ask for a motion.
I move to close the meeting at 8:38. Would someone like to second that?
Second.
Justin Dent has seconded. All those in favor? Thank you. All right, good night, everyone. We'll see you next month and we'll talk to you. I'll look for those flyers tomorrow.
Okie dokie.
Let's see, let me end this over
You got a
here.
lot of stuff happening.
Yeah, really very peaceful. Let's see, how do let's see.
Yeah, there.
It's right there.